Are we witnessing a reformation, if not a revolution, in the government's approval of vaccines? Now, if you've been watching Washington Watch for any length of time back during COVID, you know that I am not a big fan of mandated vaccines, not against vaccines, but against government mandates. Well, there have been some recent developments that suggest a positive shift might be coming as it pertains to the policies mandating vaccinations. Joining me now to discuss this, Dr. Robert Malone, co-chair of the CDC's Advisory Committee on Immunization Practices. He is also the founder and president of the Malone Institute, which aims to bring back integrity to the government, the biological sciences, and medicine. Dr. Malone, welcome back to Washington Watch. Thanks for joining us today.
Thanks for having me on, Tony. It was quite a week last week, wasn't it?
Well, I was going to say, a lot has happened since you and I spoke last. In fact, there was more news yesterday. A spokesman for HHS, Health and Human Services, reported that the FDA, the Food and Drug Administration, is doing a thorough investigation across multiple age groups of deaths potentially related to COVID vaccines. Now, this comes on the heels of last month's leaked memo from the FDA's top vaccine regulator that linked this to the deaths of 10 children. What do we make of all this?
So I have to say, number one, Tony, of course, I'm not speaking on behalf of the government. My opinions here are my own. Even though I serve on the Advisory Committee on Immunization Practices, I have seen the actual data regarding these childhood deaths that were recorded in VAERS and their subsequent investigation. There's actually many more deaths than just these 10, but these 10 are clearly extremely well documented and linked to the administration of the vaccine product. The fact that these deaths occurred and was not disclosed to the American people in a timely fashion may involve some criminal activity at some point in time. There will be a determination about that. I'm confident there will be hearings. I'm not allowed to disclose what I have seen in terms of the documentation concerning these really sickening events, one of which involves Ernesto Ramirez Jr. This Ernesto Ramirez is the gentleman that has been touring the country insisting that his son was killed by the Pfizer jab, and there's been a lot of denialism about that, but now he is among the 10 that are specifically being identified here. This is really just the first wave, the first cut at identifying those that have unfortunately passed away from these products that were mandated by our government. The government now denies that that's the case, but if you're a government worker or a military personnel, you know that that is a false narrative. Now, you asked the question, are we entering into a period of radical transparency and transformation concerning the entire vaccine enterprise? And I think the answer is yes, Tony. We took a bite out of the apple last week at the Advisory Committee on Immunization Practices, and what we recommended to the director of CDC. Remember, the ACIP does not set federal policy. The director of the CDC or the acting director in the current case is the one that will accept, refuse, reject, or modify those recommendations. But the language of the recommendations is being broadly misrepresented by the likes of Elizabeth Warren, in which she asserts that the CDC is now, and specifically she names Secretary Kennedy, is taking away vaccines from people. We were extremely careful to ensure that our wording could not be interpreted as taking the ability of anybody to receive or accept a hepatitis B vaccine. But what we did do was, and this is also a misconception, I heard Senator Rand Paul, frankly, still doesn't really understand what we just recommended. We didn't delay the first birth dose of children who have been born to hepatitis B negative mothers until 2 months. What we did was we said it's suggested that those children not take the first dose until at least 2 months, but that it's up to the parents to decide when and if they accept hepatitis B vaccine for their children. You point to your belief, which I share strongly, that it is inappropriate for the state to mandate medical procedures on its citizens, particularly without informed consent. I am against mandates, as you just indicated you are, and I thank you for that. This is the fundamental policy shift here. Frankly, Tony, public health is driven by utilitarianism currently. It is, and that is, I'm going to say the S word. That's a euphemism for socialism. The belief that the state has the right to mandate that you receive medical procedures, including injections. And where we're trying to shift the dialogue back to is a focus on the physician-patient relationship and the rights of individuals to determine what medical procedures they may receive and the importance of them having truly informed consent, informed by both a comprehensive understanding of the risks and the benefits.
Dr. Malone, we just have 30 seconds left, but if the Secretary adopts the recommendation, when will parents see the effect of this?
Immediately, except in those states that are rejecting it. We have, Tony, we are in the middle of a major battle. It's a cultural battle. And you're familiar with that.
Yeah.
You could say it's a religious battle also, and we wouldn't be off. And there are many states that are rejecting these changes, and they insist still on the utilitarian idea that the state has the right to determine what medical procedures you will receive.
All right, Dr. Malone, we got to leave it there, but thank you for being on the front lines of this battle.